Hi, everyone. This is Dr. Marra with Dr. Marra's Medical Minutes. And I'm sorry that I haven't been on for several weeks. We've had kind of a lot going on. I moved into my new office and then we had a soiree and I just couldn't get it all done. So I'm trying to get it back up and running. And I wanted to share a case with you. It's a 65-year-old Caucasian female with multiple tick-borne illness, mold exposure, and that has probably been in her for 20 years. She got infected in New York, and she's just been really, really struggling with fatigue and hair loss and joint pain and all these things, the typical, complex chronic illness patient. And so we got her thyroid regulated, we got her hormones regulated. I have her on methylene blue, I have her on Itraconazole, I have her on a couple of antibiotics, but it still wasn't cutting it. She was still profoundly fatigued and she had gained 25 pounds. And this is somebody who was in great shape and who really took care of herself. So the thought came to me, why don't you just suggest red light? Red light increases ATP production. It's really good for people with chronic fatigue. It's really good for blood flow. It's really good for lowering oxidative stress. It's a really great anti-aging tool. So I suggested to her to do red light therapy, 20 minutes, 3 times a week. So she found a place somewhere in Linwood, and she started. And after the first week, so in the second week, game changing. She doesn't have fatigue anymore. She told me she feels perfectly normal now. And this is somebody that couldn't get out of, well, she did get out of bed just because she's a highly motivated person, but she couldn't function like how she was used to functioning. And, I know you guys know that I'm on this red light kick because, first of all, I'm using it myself. I even wear like a little red light just to remind me how important it is. And I've been doing it, and I really think that it's helping my skin, and I think that it's helping my brain. And what I mean by that is I'm using this helmet. It's called Neuroradiant 1070 helmet. And what it's doing, I think, is it's increasing blood flow to my brain. And that increase in blood flow is functioning as synaptogenic. In other words, it's facilitating synapses in my brain. And synapses are what, fuel new ideas, fuel insights, fuel knowledge, fuel problem solving. I mean, they're critical. It's critical. And I'm in my 60s now, and I just felt like it was something that I needed to do to maintain that sharp edge, because what I do for a living is, it's a lot of problem solving, and I have to have a keen eye for aberrations and symptoms, and I have to be able to put things together quickly, and I really think that that's helping me. And clearly, the red light bed helped this patient tremendously. In a week, she went from not being able to function really to high functioning. Now, let's see if that's sustained, and let's see, is she going to have to do that forever, or, what are we talking about here? But I mean, that is a huge game changer for this patient. And so I wanted to share her case with you because I think a lot of you would benefit from red light. We're going to get a red light bed. We have a red light laser right now, which is more a localized beam that you used for like a localized injury, your shoulder, your knee, your elbow, something like that. but it's concentrated red light, and it's very effective, very effective. We are going to get a red light. There's a few logistics involved, so we don't have it yet, but we will get it. And once we get it, I'm going to open it up to the world, because I really think that this is cutting edge medicine, and so do my colleagues. I really think that this is going to be a new way to help heal inflammation, blood flow, oxidative stress, wound healing, tissue regeneration, all those kind of things. Which, what is that? It's aging. So I think that red light bed is going to be the new anti-aging elixir, if you will. Of course, you have to do other things. You have to sleep right, you have to eat right, you have to drink plenty of fluids, all these things, of course. But you can do all those things and you still have inflammation. But when you do red light just calms that down in a beautiful way. So I hope you found this case to be interesting, and I hope you're having a wonderful day. Thank you.